On March 11th, the World Health Organization, or WHO, declared that COVID-19 is now a pandemic. That means the disease has spread everywhere, and the world's fight against this pandemic should not only focus on preventing imported cases from one country to another. Instead, each country should strengthen its capacity to deal with the virus. Vietnam approached this method in the very early stage of the country's fight against COVID-19. So how effective is this strategy for Vietnam, and what are the next steps? Our reporters spoke to Dr. Kidong Park, the WHO representative to Vietnam, on this issue.
Thank you very much, Mr. Kidong Park, for joining our interview today. As the WHO representative in Vietnam and also the official spokesperson of UN regarding COVID-19. So what's your comment on the fighting against COVID-19 of Vietnam in its first phase?
There are two things. One is Vietnam's experience of the commune level quarantine. For 4 weeks ago, when there was imported cases in one province, and then there was a report of the additional cases among close contact. And Vietnam decided to put one commune, about 10,000 people under quarantine, and then for 3 weeks of quarantine, Vietnam was able to stop spread of virus beyond this commune, and then also very good compliance from the people of that commune. And during that period, we have observed very good service, social services, and then food and services, and a very good infection prevention control measure was applied in that commune. That is, other countries may wish to learn, and that is WHO and UN wish to share with other countries.
So what are your recommendations to the people of Vietnam in their fight against COVID-19?
This disease is not so serious, less serious than we initially thought. More than 80% of cases are mild, and then less than 20% need oxygen therapy or ventilation support or ICU support. So it's a mild case can be treated in district hospital. A condition is that they should know how to manage my COVID-19 patients with proper infection prevention control measures. From the beginning of this outbreak, Vietnam activated the system and then trained doctors from the tertiary hospital to district hospital. And we observed they are ready, they are trained, and then they are ready to cope with the cases.
Vietnam enters the second phase of COVID-19, so what's your comment on the current situation in Vietnam?
That reflects Vietnam's preparedness during peaceful time to increase the capacity of the biomedical science and then this kind of the biolaboratory system. Also, Vietnam is also cope with the approval system, reacted quite frequently, quite quickly. So having the domestic capacity of the testing reagent is quite useful. It's very helpful in responding to this situation, considering the global shortage of the many materials.
Well, once again, thank you very much for joining our interview.